Good morning. This is State Senator Karla May coming back to you after spring break. We were on a legislative spring break, and we're continuing this week with more legislation. With the end of session fast approaching, we're definitely hard at work of trying to get our agenda across this finish line. So let's talk about a couple of bills. We had Senate Bill 19 on the floor. Senate Bill 19, I believe, is very egregious piece of legislation because I think it's unforgiving and needlessly harsh. The sponsor of the bill provided no statistics to support the need for increasing what I consider already strong penalties for interfering with emergency service providers. So what he's saying is any attack on first responders should be denied any right to receive probation or parole. Now, the bill also dealt with misdemeanors. So if you go into, say, for instance, a fourth-degree misdemeanor, a fourth-degree misdemeanor could be me spitting in your face and you file charges, something as simple as that. Most times on misdemeanors, the judge has the option to give probation or a fine and up to 1 year in jail. So the bill was also dealing with those misdemeanors. And sometimes first responders may have combative, say for instance, ambulance drivers may have someone who may be combative because of mental health issues or may be combative because they're sick. There's so many gray areas and circumstances that are not accounted for in the legislation. I offered an amendment to try to make it better. First of all, our objective is to kill the bill altogether, to make sure that the bill doesn't pass. But if the efforts fail, I offered an amendment to remove misdemeanors from the bill and let the bill only deal with felonies. So that's Senate Bill 19, which, like I said, we should be focusing on criminal justice reform efforts and not punitive, non-data driven measures to further complicate our criminal justice system. The bill was laid over pending that amendment. Now, we also discussed Senate Bill 65. Now, this is another attempt by the legislature toward reform. And this is talking about injury litigation and the amount of damages an individual can receive through that litigation. So basically what it's saying is, in some instances, when there's a tort claim, maybe let me give an example of doctor-patient. People might understand that better. In a doctor-patient scenario, it could be something happened doing surgery. So the patient now wants to sue. So at the onset of that suing, it says that it's some damages that are already accounted for, but I can also give a threat of punitive damages as well. So what this legislation is trying to do is trying to clarify the standard for providing punitive damages. And in some cases, people think that it's been watered down over the years. So this is the bill that we're considering, Senate Bill 65. It has a lot of dissension among the senators in reference to what is fair and what is right concerning Senate Bill 65. So I have to tell you right now, I haven't made a decision in reference to Senate Bill 65. We are still exploring possibilities of fairness, just trying to balance the scales in the instance of Senate Bill 65. Another bill that was voted out of committee unanimously was my Senate bill combined with Senate Bill 8. It was in the Criminal Justice Committee. But what we're trying to do is reduce the use of mandatory minimum sentencing for certain offenses in the court. So for certain crimes, we took out certain crimes that will not have mandatory minimum prison terms. So I talked about this in previous podcasts. So right now the bill is moving. It's on the calendar to be voted on. So we're hopeful that we'll get that across the finish line before the end of session. So lastly, the only thing we're considering, we're still talking about prescription drug monitoring program. There was a House Bill 188. We already talked about the Senate bill in previous conversations. There is a companion Senate bill. This would establish the statewide PDMP and allow physicians and pharmacists to access a patient's prescription drug history. And this is in the hopes of curbing the overuse and misuse of opioids. Now, the arguments that we've heard in reference to PDMP PDMP or talking about privacy issues. Now, the only thing you have to do in this instance is weigh, the concern for the privacy issues with the concern of saving lives. That's what you have to balance it with. They're talking about the system being hacked and that patient prescription drug information becoming public. Well, in the day and age that we live in, all of your personal information can be hacked, no matter what medical database is in. Your doctor's office has your medical information in a database, and that can be hacked as well. This PDMP is just allowing for pharmacists in one area and pharmacists in another area to know that this prescription has already been fulfilled in essence. Well, that's it for today. This is the week we came back to. Very busy and complicated week of session. Like I said, we have 7 more weeks to go. Look forward to talking to you next week. This is Senator Karla May. Stay tuned.